we have two different types of diabetes. One, type 1 diabetes is majorly found in children, and it's mainly as a result of lack of insulin in the body. So people who don't have insulin in their bodies, they don't have sufficient levels, then it means they need to be injected with insulin. And if you guys, for example, if we have anybody who has been on diabetes type 1, they understand that the major line of management has always been use of insulin for these patients. So then for diabetes type 2, there is relative insulin deficiency or insulin resistance. This majorly comes up when people are adults, people are grown-ups, and when you're a grown-up, the problem that we have is you develop resistance to insulin that your body is producing enough, but it's not giving you the ultimate outcome that is required of it. Reason can be because of increased body fats. That is an issue. And that is why we normally recommend physical activity, physical exercises, and all that. Then another thing can be as a result of failure of your pancreas to produce sufficient quantities of insulin as well. So those are the key things that we find when it comes to diabetes. So the normal level, and then we have to understand that the diabetes type 2, which is the main focus of our discussion today, is the most prevalent one. Majority of people have diabetes type 2, that's 90 to 95% of the population, out of the patients with diabetes, and the other 5 to 10% have diabetes type 1, or are in the minor categories, that is gestational diabetes and pre-diabetes. So gestational diabetes are people who have elevated sugar levels during the pregnancy period. You find a pregnant mother having higher sugar levels. It might not be because they have diabetes, but because they have an elevated sugar levels attributed to either increased fat accumulation in the abdominal region, and then there are people who are at risk of getting diabetes, and they are called pre-diabetes. Their sugar levels are not high enough to be considered diabetics, but at the same time, their sugar levels are not within the normal range. And the normal ranges are the ones that I've given down here. If you guys are able to see my screen, there's the normal less than 11.1 millimoles per liter. So, and on the poster that we had, you can see we had the glucometer as this image that we have, somebody testing their sugar levels. So the values that are normally indicated, they come in the millimoles per liter. And normally we recommend having glucose levels between 4 to 11, less than 11. That is either random or fasting, but fasting should be less than 5.6, and it's taken 8 hours of fasting. If you took your dinner at 8 in the evening, then tomorrow in the morning when you wake up, let's say at around 7, you take your sugar levels without taking anything, it should be below 5.6, but should be above 4. If it goes below 4, then you are going to be hypoglycemic, and hypoglycemia, the low sugar level is another problem again. So we have to ensure that your sugar levels are within the recommended range. They're properly managed at that condition where you are. What are the key risk factors that we have with diabetes? The major diabetes risk factors we have: hypertension. People with high blood pressure tend to develop diabetes as often. Then also we have smoking, fast food, the kind of food that we eat. And that's why we have diabetic patients or people who have diabetes being told that they need to look into their feeding patterns. It's recommended that we get to a point where you can do physical exercises, keep fit to reduce your body weight as a recommendation in managing your diabetes. Then another thing we have in terms of the age, elderly people, as I mentioned, the majority of people who have the most prevalent diabetes type is diabetes type 2. So if diabetes type 2, it comes with the elderly, that is overweight, deposition of fats increases as you grow up and all that. So being you have an age of 45 years and older, chances of getting diabetes also increase with that age. So it means at that point, you need to take extra precautionary measures that should include exercising, keeping an active lifestyle, either walking to work, walking around after your work schedule, weekends, having a walk with your family, and all that kind of activities that will enable you keep an active lifestyle. You manage your hypertension, that is high blood pressure. If you have high blood pressure, you need to ensure that you're managing your blood pressure, or if you have your medicines. If not, you reduce your salt intake, regulate the kind of food that you're eating that might be predisposing you to having high blood pressure and all that. So those are the key cornerstones of how we manage the risk factors. And one of the risk factors that I didn't mention was the family history. Family history, when you have a family member who has diabetes, chances of you developing diabetes as well are heightened. So if that is the case, then it means there's no control we have, but you have to take extra measures to protect yourself from getting diabetes. Because if you have a family member who had diabetes, you might get diabetes as well. So what do? Keep an active lifestyle, look into foods that you're eating, and those kind of measures. Avoid smoking, keep an active lifestyle, and always monitor your sugar levels based on different routine medical checkups. It's very critical. So having talked about that, at this point in time, we understand we have coronavirus, which is coronavirus disease, which is causing havoc all over the world. And we need to find a way to respond to the current situation. And as we respond, we also need to understand the implication that it has to people who have diabetes, because these people are either one, they are our patients if we are doctors, they are our brothers and sisters, mothers or fathers, and our relatives in our families where we live, or they are our children, or they are us. For some of us, we have diabetes. So it means, what are the implications of this condition to us who are suffering from this kind of condition? So that is why we need to look at it. So one, we want to understand that in terms of the evidence that has been populated from the point that coronavirus disease emerged in China, that is in 2019, December, the first case was reported on 28th. Most of the people who contract the disease and suffer severe conditions, if a diabetic patient gets coronavirus, chances of them developing a very serious condition which needs further management are higher. That is in terms of ventilation, and even the people, if they get the disease, chances of them dying is high. Because looking at it from any other condition, if you're sick, chances of you being very sick and not being sick are already there. If you already have the infection, getting very severe condition will be higher. Then from that point, if they're already at a very critical condition, chances of dying are also high. So if someone has diabetes, getting coronavirus presents them an extra risk to be more sick. And if they get severely sick, chances of dying as well are increased. So that is why we need to look at it from that angle. And why is this the case? From the evidence that is coming up, it's not conclusive. There are still gaps that are within the system. But you have to know, when you have diabetes, your immunity is reduced. You have a weaker immunity, and with a weak immunity, chances of getting any other infection are already heightened. Two, high sugar levels, which occur as a result of poor control of diabetes. If you don't manage your diabetes, or the patient doesn't manage, or your relative doesn't manage their sugar levels well, they have high sugar levels. With high sugar levels, for example, if a disease attacks your viral disease, we understand that viruses use your own cell development, cell division mechanisms. So if that is the case, then it means the growth of your cells is higher. As I mentioned initially, insulin enables your body to use glucose. If you have high sugar levels, the cells are replicating at a faster rate, and it means the viruses that are growing within the cells are also increasing at a faster rate. So you have high number of viral particles in your body. So that will affect how you develop a severe condition if you have coronavirus. Then the complications of diabetes that are coupled with COVID-19 complications. So for the evidence that has been coming, people who have kidney problems, they are at a higher risk as well. And also coronavirus is causing kidney problems, acute kidney injury. Then with people who have diabetes have an increased risk of developing kidney problems. So that is why they have to ensure their sugar levels are maintained at an optimum, which is a lower level as much as possible. Then also with diabetes, high sugar levels, chances of blood clotting are high. So if your blood is going to clot, it means it can't transport oxygen enough to the different tissues. And we understand that coronavirus is a respiratory condition. So if you have high chances of clotting, your blood will not supply enough oxygen to other tissues. And even coronavirus now compromising your breathing through the nose, then it means you're not going to be able to supply your oxygen demands for the body. And that is affecting the overall outcome for diabetic patients who end up getting coronavirus. And that's why it's very critical that we try as much as possible not to expose these people to infection, not exposing them to infection. And if they get the infection, they need to get very timely response so that they get managed as early as possible. And two, when we are protecting them from getting the infection, we need to ensure that their sugar levels are maintained, are managed at a lower level within the normal range. As I mentioned, that should be 4 to 11 at most. let's say after eating and all that, when you have energy in your body. So from that point, we have to look at it in terms of what are the things that we can do to ensure that we protect them from getting an infection. To protect them from getting an infection, one, we have to ensure they can stay as much as possible within the houses where they stay, avoiding contact with other people, because we understand the main mechanism of transmission is through contact with people or through breathing, inhalation of respiratory droplets, coughing, sneezing, or contact with surfaces that have the particles. So we can, when you're staying within your house, chances of you getting into contact with infected particles or sneezing, like inhaling air from some other person who has been infected, are minimal because you live with your family, unless one of them is already infected without your knowledge. If they are infected, they should be in a hospital. So ensure you stay at home. Other than that, have a response plan in case you get ill. And that response plan should it should cater for transfer from your home to a hospital where you'd be managed, or the other response plan that we can have, other than the transfer to a hospital, is ensuring that you get people who will be monitoring you and looking at your healthcare condition. And now at this time, we have telemedicine where people are having consultations on phone and everything. You're getting managed. Two, for the diabetes now, monitoring of glucose levels. Most of the patients who have diabetes normally have the glucometers and the strips with them at home to monitor their sugar levels, and that will guide them in terms of amount of insulin that they inject. And you find when the glucose levels are high, it's recommended they inject. When they're lower than the required level, or almost, let's say, around 4.2, it's not recommended because you might go to hypoglycemia, which is very low sugar levels. And very low sugar levels are not recommended. So we try as much as possible to ensure the body's sugar levels are at the optimum level. So regular monitoring of glucose. Then once they've monitored their glucose, they have to comply with their medicines. The different medicines that are being taken by diabetics, starting from metformin and all the other oral drugs. Then we move to insulin for the people who are injecting themselves. Type 1 is majorly through insulin. Type 2, we have insulin at the advanced stages when now the body is not able to produce enough insulin because of progression of the disease. And they have to ensure they comply with their medicine. So when we talk at that compliance with medicine, we are trying to tell you, don't go out of your home, because getting out of your home might predispose you to being infected. So that exposure to infection, we're avoiding it. How do we respond to that? We have people who are living with these people. We can get these people to try as much as possible to go buy the medicines for them, get them refills for in case they are out of stock of those medicines at their home, which is the first thing. Two, if those are not options, there are different organizations that are coming up with online deliveries and all that. One of the example, we want to have this session with MyDawa. It's an online pharmacy that's currently working in place. And what they've done is they've established a system where you can upload your prescription. Once you upload your prescription, or the prescription for the person you're managing, if you have doctors in the meeting, you upload the prescription for this patient. That prescription will be reviewed. The medicines will be processed. Payments can be made. If someone has an insurance, they're engaging with different insurance organizations, companies, to ensure that your insurance can cater for your medication cost. Then a rider will be transferring that medicine from their site to your home. It's contactless, and even the entry of the insurance code, instead of using your card, they're going to use the number. There's an OTP number that they're now adopting in place. So avoiding contact, but ensuring you get your medicine. Two, we understand that these patients need follow-up and guidance on how to take their medicine every other moment. And based on their sugar level, there's that kind of professionalism that is required. On their end, because they're working on this, they've adopted a management plan that integrates having a professional on call. So once you've made your order, and once you've received your medication, then that professional, the pharmacist on desk, will be able to advise you on how to take your medicines, whether to adjust your insulin dose or all that. And in case of anything, they're willing to give the extra support that is required. So you buy online, you're not being exposed. It's delivered to you without contact to any other person. Then payment is also through the insurance. If you have an insurance that you might fear it's not going to be accepted, Or if you're going to pay you through M-Pesa, they have a payment option. So those are all opportunities that are giving people. And then the consulting point in terms of professionalism in service delivery. That's done. Then the next phase in house on the physical activity and dietary modification, including sufficient hydration. You understand the first approach when you're dealing with diabetes is to ensure you manage your weight, manage your sugar levels, and with physical activity, you're using the sugars in your body, so they will ultimately go down. And two, another benefit of physical activity, it helps you burn fat. When fats are being burnt in your body, receptors where insulin works are exposed. So when we're talking about diabetes type 2 being manifested by resistance to insulin, it's because the receptors are not open for insulin to attach to it. So when you do physical exercises, resistance levels are reduced. You can use up glucose well, then it means your sugar levels will also reduce. So it's a win for you, and it's also a good thing for a diabetic care. Then in terms of dietary modification, I mentioned it earlier, we have to ensure that this is done. If the individual, you're staying with them, you're guiding them, ensure they modify their diet based on we have the normal pyramid for diabetic diet, diabetic plate. We have to ensure they do fruits. In terms of the carbohydrates that they take, should be low glycemic index. And that is, we avoid the white bread, go for the brown bread, so that they have sufficient sugar levels over a long period of time, instead of giving them a particular meal that will give them a high sugar level at that point, which can lead to sugar rush. And because they are already diabetic, it affects their control of diabetes at that time. So we have to look into that as well, and ensure they take sufficient quantities of water, because we know from the classical signs of diabetes, we have polydipsia, high thirst levels, high levels of urination, and high hunger, polyphagia. So those are key things that we need to look at as well. Then other than that, for the people who are in the championing space, who are advocating for access to care for people living with diabetes, it's very critical that at this time we look out for these patients. Unfortunately, diabetes care is on an individual's own cost. But as champions, the main thing that we need to do is ensure, one, there's access to people who can take care of them. We have endocrinologists, we have medical doctors who are taking care of the diabetic patients. They need to be available as much as possible. As I mentioned earlier, they have, for Maidawa, they have a pharmacist who is responsible for all this. But in every other space, what are we going to do to ensure people have access to care? That is one. Two, the medicines should be available in the different facilities. If they're not available, then it's our responsibility to call on availability of them. And then we have to realize that in different facilities, there are different brand drugs. So might be the cost will be an issue. So we have to find a way that the affordable products are available to patients who need them. And when the patients are able to get the medicines they need, their control of sugar diabetes will be better. And that is someone's father, someone's mother, someone's brother, sister, or that. And at the end of the day, we want the best for each and every individual as a socially responsible society. Then the next phase, after we've advocated for all that, for the people who are suffering from diabetes, people you are in contact with who have diabetes, whether you are a doctor, a relative, and all that, we have to ensure they have proper control of diabetes. And there is the sick rule. In terms of sick rule, there is sugar control, that is sugar monitoring of their sugar levels every other time. You need a glucometer for that. Insulin administration in the right doses as necessary. And other than insulin only, we have other anti-diabetic drugs that need to be taken. That is in terms of now compliance. Insulin administration at the right dose as necessary, and it should be properly stored. That is another critical component. Then we have carbohydrates, the right ones in right quantities. As I mentioned, there's the low glycemic index and the high glycemic index, or depending on how that carbohydrate that you're taking will enable you get sugars. Bread, the white bread that we normally take, it has a high glycemic index. It means it will give you high sugar levels abruptly in a very fast response, which will not enable you get the right concentration of sugars for a long period of time. So with the hikes and everything that comes with such kind of foods, it's not recommended. You can go to the yams, you can take arrowroot, You can take the normal viazi and all that, which are going to give you sustained sugar release over a period of time. Then you can look at ketone bodies should be monitored as well. And ketones are majorly produced. That's an issue for people with type 1 diabetes. And those with type 2, it's when they're using insulin that should be in an advanced case of diabetes. And there are strips for that based on tests on urine. It looks like the pregnancy test that we normally have for pregnancy for women. So that covers the major things that we need to look at, and we need to ensure that our patients are well taken care of. And that marks the end of the presentation that I had for you today. So in case you have any questions, you can raise your hand. We can have a chat on the same and find a way to work through this. Thank you. Anyone who has a question?
Yeah, our question.
Yes.
Good evening.
Good evening to you.
Thank you for cleaning up this initiative so that
Thank you.
we can talk about diabetes.
Thank you.
Now, the way you have explained
Yes.
looks like almost it is the normal way of doing things,
Mm-hmm.
and yet we are talking about diabetes in relation to diabetes.
I'm losing you.
I mean, so I'm saying, we are talking about diabetes in relation to COVID-19.
Yes.
Now, you are talking about we are talking about people living with those conditions.
Yes.
Now COVID has come.
Yes.
Now you have now talked about how we can get a drug from maybe like my dawa.
Mm-hmm.
Now my question is this:
Yes.
what is the government doing about that individual who is down there in reserve settings?
Okay.
So
So
this person has no connection to like iPad or like my phone, a
yeah.
smartphone,
Mm-hmm.
to buy a drug from my dawa.
These online platforms, yes. So in that
Now
kind of a
what?
situation,
Yeah.
I won't say what the government can do on their end because I'm not part of the government in that response. But as individuals who
Oh,
we are taking care of these people, it is our mandate
mm,
to ensure they can get access to the medicines. So one, you as an individual can look at ways of supporting that person and ensuring they get access. And two, as a champion,
mm,
in that local
mm,
community, there is a health center, there is a dispensary, and there is a hospital
mm,
where they normally get their
mm,
medicines. Chances are there might be no medicines in those stations. So it's our responsibility to call out the
mm,
government to take responsibility for that. And then another
mm,
thing, in terms of accessing these drugs, we understand diabetes, non-communicable diseases generally, their care is not being catered for by the government fully. So at the end of the day, you have to pay for the medicines, you have to seek care where you can afford that care. So maybe the only angle would be now advocating for access to the other generic drugs, which are the same drugs with the same effects to the patients, but they are cheaper to the patient, who it makes them able to be affordable. So that is the
okay.
best I can say at this point. Yes. Thank you.
Thank you.
Any other person who might have a question? Any other question? If you're not able to speak
Hello.
up, you can, yes,
Thank
you
you for
can
the
type on the chat
presentation.
box as well. Okay, Eric.
Yes, it's Eric.
Yes.
So my question is, actually what I've noticed across the world is that most of the people hopefully passed because of diabetes and COVID.
Yes.
Because of also the not being given the right type of food when they're at the hospital. You'll find like the normal food at the hospital is maybe the chapatis and rice, which tend to increase the sugar levels, just in
Yes.
case in terms of the virus multiplying. So
Yes.
maybe since also you work at international hospital, is it
Yes.
something that also the team or the nutrition team is working on to make sure that anybody who's diabetic gets
Yes.
more protein and the fatty foods as
Yes.
compared to carbohydrates to
Carbohydrates.
reduce
Yes.
the in terms of risk of increasing COVID-19 infection to diabetes.
Okay. So actually, that is another action point that can be looked into, and that can be advocated from the people among us within this very group. Because you look at it in terms of management of these patients, when they're taken to the wards, you can't prepare special that doesn't happen generally. So it means they will eat the same food that has been given to every other person, but they have a special condition that needs special consideration at this point in time. So those are things that needs to be brought up as well. Thank you so much for that, Eric. Any other person who might have something to share with us? So if there's none, I think this marks the end of our session. And thank you so much for joining in. We'll have another session in the coming week. That will be on Saturday. Then that might be on another condition, but look out for those who registered. I'll send the link out again for the next session on Eventbrite as usual. And I hope we get to learn and make a difference in impacting the lives of people around us. Thank you so much.